Good morning, everyone. I don't have a formal PowerPoint presentation, but we'll go through a couple of important points to hammer home and emphasize. Obviously, starting with our COVID numbers. The COVID numbers remain low overall. However, there have been some increases across the state and small increases in our local numbers, as referenced by our test positivity that is now at 0.8%. And the number of new cases, there have been multiple days where we have been in the high teens, and this morning it was actually 20. Our hospitalizations have not correlated in terms of increase. We've only had 2 hospitalizations, overnight. And the hospitalization numbers remain low, even in the small increase in those daily cases. Now, looking at the numbers, the state has repeatedly said new cases are overwhelmingly tied to individuals who are not vaccinated. Deaths, COVID-related deaths, are tied to individuals who are not vaccinated. COVID-related hospitalizations are tied to individuals who are not vaccinated. And so if you're recognizing a theme here, the overwhelming cause for our continued transmission and the presence of COVID within our communities are in individuals who are not vaccinated. And we do recognize that for younger children, they are not yet eligible to be vaccinated, but we do have a significant portion of our population, particularly in the 20 to 29-year-old group, that has low rates of vaccine uptake so far. When we break down the new cases in the last month, and again, I will send you all this file at the conclusion of my remarks. But when we look at cases over the last month between June 10th and July 7th, 18.4% of those cases, which is the largest group, is 20 to 29, followed by 17% of new cases in 30 to 39-year-olds. Next largest group is 12%, which is 40 to 49-year-olds, followed by 11.8% in the 10 to 19 category, and 11.4% respectively in the 50 to 59-year-old group and the 60 to 69-year-old group. 10% of new cases during that time period are in ages 0 to 9. When we break that down by race and ethnicity, looking again overall during that last month period, 25% of new cases are in non-Hispanic Black residents, 20.6% are in non-Hispanic whites, 20.6% is unknown, 17.5% are in Hispanic residents, 3.5% are in non-Hispanic Asian residents, and 12.7% in other category. So I say all that to say that as I'll pivot to vaccines in a minute, where we've had tremendous success in that, we still see reservoirs and pockets of COVID-19 in our community, in large part due to the remaining individuals who are not vaccinated. So I want to emphasize and set out another ask and call for any individual who's not vaccinated to encourage them to get vaccinated, to protect themselves and to protect their families and the overall community, to drive numbers down. Now, when we break this down, obviously there's lots of attention talking about the Delta variant. That has become the predominant strain in the United States. On a call with the state this morning, those samples that have been sequenced by the state, approximately 50% remain the Alpha variant or the UK variant, the B117. 40%, which is on the rise, represents the Delta variant or the Indian variant that has received a lot of attention and becoming the predominant strain across the world and across the country. There have been sporadic reports of a Lambda variant, which is the name for the Peruvian variant. That it's been referenced, but I have not seen any reports of Lambda cases being sequenced out of Montgomery County. So it's important to continue to monitor those trends as well, because obviously we're concerned about the Delta variant being more contagious and potentially causing a more severe COVID picture, again, particularly in those individuals who have not been vaccinated. Now, speaking of vaccines, I want to report our most recent numbers. We continue to lead the country in terms of jurisdictions and counties over 300,000 individuals, as well as the percentage of residents covered in the state. When we look at just those individuals who are eligible, being 12 and up, We have 89.6% of our population having received at least one dose and 81.4% of our population being fully vaccinated. When we look at the population over the age of 65, 98.3% of those individuals have received at least one dose, and 92.6% of those individuals have been fully vaccinated. And when we stretch that out to the total population, 76.1% have received at least one dose, and 69.1% have been fully vaccinated. We continue those efforts, working with our community partners to expand vaccines, particularly in those zip codes that continue to have lower rates of uptake. And we, again, have consolidated the county apparatus into 3 sites, Dennis Avenue, currently at our 401 Hungerford site that will move to Montgomery College in Rockville, and the Up-County Regional Service Center. That's open Monday through Sunday, 9 to 6. Individuals can get tested as well as get vaccinated in those spaces. Now, the last thing I'll mention in terms of COVID-related things and move on to questions and other general things is there have been a couple of updates recently from CDC and others. The first one is the CDC on Friday did put out updated guidelines related to returning to school in terms of face covering recommendations as well as spacing recommendations and so forth. We've met with MCPS again throughout the pandemic and throughout the last several weeks to help inform and provide guidance to them in terms of their ultimate policy that they will put forward for schools. I know that they're continuing to work on that. And the state this morning in the call referenced that now that CDC has put forth that set of guidelines, MDH and MSDE will be working on a state version of that to provide to the local school districts. I continue to be a proponent, as referenced by the public health recommendations put out several weeks ago, that any individual who is not vaccinated should continue to wear a face covering when around other individuals. Particularly those, regardless of the cause, whether you've chosen not to receive the vaccine or if you're not eligible to receive the vaccine. And particularly as it relates to children under the age of 12, that recommendation is consistent with the recommendations from the American Academy of Pediatrics, as well as consistent with the recommendations that the CDC put forward on Friday. The second item that has come up over the last week has been the question of whether or not boosters will be needed for vaccines. Representatives from Pfizer met with the FDA and CDC and representatives from the White House, I believe, on yesterday. There seems to be some disagreement on that. At the moment, the federal level continues to support that. At this time, there's no indication that boosters will be needed for Pfizer or Moderna shots. But as that continues to evolve and we get more information, certainly we will continue to keep you apprised of that. And we continue to contingency plan should we need to provide boosters to the community in the fall. There have not been any updates or indication of an updated timeline in terms of when the vaccines will become available to children under the age of 12. The third piece is that recently, yesterday, the CDC has put out language related to the Johnson & Johnson vaccine. There have been a number of cases and individuals who received the Johnson & Johnson vaccine who went on to develop Guillain-Barré syndrome. It is a small number of cases, and they are currently investigating that. I don't have any further information at this time, but again, as we find out more information, we will certainly make that available to our residents in a clear, transparent way to help them guide their medical decisions and be on the lookout if any particular symptoms develop. Now, the last thing I would mention, and this is a non-COVID related piece, is to remind people that health continues. We've talked about this before. And on a couple of things I want to emphasize is particularly for children in the vaccine and immunization space, we need parents to get their kids caught up on any vaccines that they may have missed over the last year due to COVID and not being able to access the healthcare enterprise. We encourage you to take advantage of the summertime to make sure that your child is up to date with their routine standard vaccines as we move back into the school reentry space in the fall. Additionally, we encourage folks who have not had any type of physicals or primary care prevention visits in the last year and a half during COVID to go get your checkups, get your annual physical. check your blood pressures, check your glucose, and all those kinds of things to make sure that you're staying in shape and healthy. And the last thing is, again, continuing to encourage folks to be safe in your activities this summer in terms of being around other individuals, partaking in summertime activities such as swimming and those kind of things, and making sure that you're taking the necessary safety precautions to keep you and your family safe. Drink lots of water, stay hydrated, check on your elderly residents or those who may be have some mobile complications, particularly given the increased temperatures, and make sure that they have adequate provisions to stay cool and stay hydrated to stay safe. I will conclude my remarks there. Happy to answer any questions. Dr. Bridgers, did you have any additions from public health perspective?
Good morning, all. Yes, Dr. Gales, just a couple of updates. Just wanted to remind all that we continue to provide testing and vaccination spaces. Please visit our website, montgomerycountymaryland.gov/COVID-19/vaccines. Although appointments aren't required, we do encourage folks to make appointment online for accountability so that we can make sure that we have enough vaccines on site. We are currently testing and vaccinating at 3 sites: at our Dennis Avenue Health Center in Silver Spring, at our Montgomery College Rockville campus, and at our Up County Regional Service Center. All these spaces and places are located with the addresses on the website. They are accessible via public transportation. And we're testing and vaccinating Monday through Sunday from 9 a.m. to 6 p.m. That schedule may vary. We also have our community partners testing and vaccinating as well, and they may have a variation of that schedule. Lastly, I'd like to encourage folks, if there are any spaces where you think that we should have a vaccine site or host a vaccination pod, please, again, visit the website. There's a link. Click on Suggest a Vaccination Site, and we will visit your space. We know that there are community events that go on throughout the summer, and we would love to come to your community to provide a testing and a vaccination space that's available. Finally, if you travel to any spaces throughout the United States or abroad, and you feel that you've been in close contact or you just aren't sure, I encourage all to get tested. We have those testing spaces available, and we'd like to have you visit those spaces and get tested, but more importantly, get vaccinated. Thank you, Dr. Gales, for allowing me the opportunity to provide that update, subject to any question from the council sitting as the Board of Health.
Good morning. I have just a couple additional comments. As you will know, we've closed down the mass vaccination site at the Germantown Montgomery College campus. We did transfer many of those activities over to the Up County Regional Service Center. I did want to report that in the period that the site was operating, we performed more than 75,000 vaccinations, both combining first and second doses at that site. So obviously it was a huge success in the time that it operated and really pushed us farther along. I did want to add one additional comment to what Dr. Gale said, and Dr. Fauci did report earlier this week that 99.2% of the fatalities over the last month from COVID-19 have been in the unvaccinated. And so obviously what we're seeing at the local and state level is also a national trend whereby vaccination obviously is a key indicator of who is suffering the most severe consequences of the illness. We are, I will say, watching very closely what's happening in other parts of the world where the Delta variant has more thoroughly taken over. I think, as we've said in previous briefings, we fully expect the Delta variant, given its increased transmissibility, will take over as the dominant strain, both in Montgomery County, the state of Maryland, and everywhere else in the country. And so obviously we watch what's happened in other countries, and we look at, take Israel. I know we've talked about that a little bit, where people have illustrated maybe some reduced effectiveness of the Pfizer vaccine, but I think it's key to recognize that the reduced effectiveness of the Pfizer vaccine is only seen really in people being capable of being infected by the disease. the vaccines are still wildly 98% effective against preventing severe illness, even in the cases where people have gotten infected with the Delta variant who were vaccinated. And so I think that's a key thing to recognize, is that even in cases where the Delta is more effective at potentially infecting people who have been vaccinated, it has not been proven more effective in making them severely ill to the point that it requires hospitalization or cost people their lives in significant numbers. So it is important to recognize that even, the data is still out there on exactly what the reduction in effectiveness is against the Delta variant for any of the vaccines. But even in the cases where there is some degree of reduced effectiveness from preventing transmission, it's not seen in the severe consequences and outcomes. And so that's all I have this morning. Happy to take some questions.
Thank you all. Council Member Reamer.
Thank you. First, just a brief comment on this data point. We're talking a lot about how among recent deaths, that they're almost exclusively among the unvaccinated. And that is definitely true. It also occurs to me that if you look at the big picture, there's been 607,000 deaths so far, thanks to this pandemic. And almost all of them have been among the unvaccinated, because of course, everyone who was dying in the first 6 months and year of the pandemic they were not, 6 months, they were not vaccinated either. So, it's just that everyone who has died, except for a handful of cases, is my understanding, has been unvaccinated. And that trend, of course, is continuing now. So, folks need to understand, like, you're comparing, if you're concerned about the impact of the vaccinations, you can look at the ledger. 607,000 deaths among the unvaccinated, a handful among those who have been vaccinated, for reasons that are now, I understand as well, managed. The J&J warning is now managed. And so the prospects of any future serious adverse health, event from that is essentially now not a great risk. So, the ledger is even more dramatic in some sense than we might explain. So I do understand from talking with, from input I've received, that there's an open question as to whether we can mandate vaccinations for students. So I think we can just keep our eye on that and, hear from you as that proceeds and there's more clarity. I do think we ought to require vaccinations if we can. If we can't, then, we'll need another level of government to act that. And I do recognize and appreciate the general point about get your regular vaccinations. I think people are comfortable with that. And, it's a good message for us to be putting out there. So noted, and, appreciate that. So that's it for now. Thank you very much.
Councilmember Ruber, thank you for your question. And you did ask about mandating a vaccine. So that level of policy would be set forward by the State Board of Education and MSDE. And at this time, I don't have any updates in terms of if they've decided to take that action, and we're still waiting to see if they'll take that level of action.
Great. Thank you, Doctor. Council Vice President Albornoz.
Thank you, Mr. President. Thank you to all three of you for your continued dedication and that of your respective teams. I have noticed sort of a trend that's not entirely surprising, but still disappointing, which is, and I'm especially in tune to this, as you guys know, and all of my colleagues that have children understand, for those that are under the age of 12, I'm seeing fewer and fewer of them wearing masks indoors and at gatherings. We were in church last weekend, and we were one of the only families. This was not in Montgomery County, but we were one of the only families whose kids were still wearing masks. And so if you could just stress once again, Dr. Gales, the importance of those unvaccinated, but in particular children. And as we're seeing nationally, there has been some disturbing information about some of the variants impacting kids. If you could stress that again for everyone, until the vaccine is available to everyone, but especially children, the importance of wearing masks, particularly for our kids who are unvaccinated.
Thank you, Councilmember Albernos, for your comment, but then also thank you for continuing to have your children wear face coverings and protect them and protect community. I'll be very clear from a public health perspective. It is in the best interest of individuals who are not vaccinated, particularly those who aren't eligible to get vaccinated, to continue to do so to protect themselves and protect their families. When we look at the breakdown in the last month, 22% of our new cases were under the age of 19. And so that includes children who are under the age of 12 who are not eligible for the vaccine, and a variable number of children who are 12 to 19 who, for whatever reason, have yet to be vaccinated or have chosen not to do so. And we know that they can get sick. And particularly with the Delta variant, we know that they are at an increased risk of having a more complicated medical a COVID trajectory than potentially with the novel strain that we saw last year. So we want to make sure that folks don't develop a false sense of security to say, well, if children get it, they're going to be completely fine. We don't know that for sure, and particularly given the advent of these new variant strains that are more contagious and could potentially cause a more severe form of illness or course of illness, we can't definitively say that. So overall, kids are susceptible because they're not vaccinated. And we encourage parents and families and others to take the steps needed to protect them and keep them safe until they're able to get the vaccine.
That was perfectly said. And I'll just end with a comment, but I think all of us watched with horror, including Dr. Fauci, who specifically referenced at a partisan conference this past weekend where people were literally cheering, not having hit vaccination goals nationally. That we've come to this is just shocking and depressing. And we just continue to be fortunate that at least here in Montgomery County and through most of the state of Maryland, we have followed the science from the beginning, and we have followed that guidance with really remarkable outcomes when you consider everything that we've had to deal with this last year and a half. So we all must remain vigilant and leaders in this space. And I want to just once again end by thanking all of you for your continued dedication. I yield back to you, Mr. President.
Thank you, Council Vice President. Councilmember Glass.
Thank you very much, Mr. President. Good morning, everybody. As we have these every other week discussions, the news continues to improve. And the 89.6% of eligible residents who've received one dose and the 81.4% who are fully vaccinated is fantastic. Juxtaposing that to the comments that the Council Vice President just made about sentiments in other parts of the country. And Dr. Gales, I think you had said, and I missed it, but I'd like you to reiterate it for my own purpose and everyone else's. Our vaccination rates are the highest among large counties, or can you repeat that?
Yes, so thank you, Councilmember Glass, for the question. So as best as we can tell over the last several weeks, for counties over 300,000 in population, we have been had the highest percentage of our residents vaccinated in terms of eligible population.
That is
That's across the country, not just in the state.
And that is a true testament to the work your teams, all of the doctors here, and everybody else in county government and state government who are helping in those efforts. And again, going back to some of the national sentiment that we've been hearing lately, troubling national sentiment. When President Biden was saying that we need communities and local governments to go door to door, knocking on neighbors' doors, encouraging them to get vaccinated and offer the direct assistance for them. That is work that we've undertaken months ago, that we all recognized was so important because we saw the racial gaps that were existing and knew that we had to extend more of our support into those underserved communities. And so I would suggest that we offer our knowledge and expertise for the facts that you just outlined as the county, one of the largest counties, if not the largest county with the highest vaccination rates, having been doing this work for months, offer our assistance, your assistance and expertise, all of you, to the county executives and the governors and the mayors across the country who are hesitant, who don't quite know how to undertake this work, because we've been doing it, you've been doing it, and we are proving successful in it. And we can't give up until as many people who want to get vaccinated get that vaccination rate, get those vaccinations. But the proof is in the pudding, and the hard work that we have been undertaking for months and is working. And so a genuine and sincere thank you to all of you and your teams. And I look forward to yet another update in the coming weeks with hopefully even more increases in those vaccination rates. So thank you all for the work that you're doing.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. And again, thank you to all who are literally saving lives in Montgomery County and beyond. You know, I didn't want to put you on the spot, but Dr. Gales, I think you stay on the spot, as does your team. Someone is always looking to you for information, and thank goodness you always give it to save us all. But the other day, I was in a grocery store. I seem to spend my life in a grocery store. I was in a grocery store and I was wearing a mask. A person who knew me came over and who was not wearing a mask and said, "Why are you still wearing a mask? Weren't you, vaccinated?" I said, "Yes, I was, but I figured that in a grocery store, if you're going to meet someone, especially a person, a child who couldn't get the vaccination, that you might meet them in a grocery store. And I just wanted to be careful." And they said, "Does Dr. Gales wear a mask in a grocery store?" And I said, "The next time I see Dr. Gales, I will ask him." So can you give any insight as to what you do and what others might do as well?
Well, thank you, Councilmember Katz, for your question. And certainly if you find any deals in the grocery stores, let me know. I spend a fair amount of time shopping as well, always looking for a good bargain.
I will text you. I will text you.
I appreciate that. So I actually try to be very strategic in terms of when I go out in public. In the off chance someone may say, "That's Dr. Gales, I'm watching what he's doing," that kind of thing. And so I've tried to help build confidence in terms of, being fully vaccinated and so forth. I've tried to not wear my mask as much in public to show, to pattern that, I've been vaccinated and I'm moving about. So I've probably more recently haven't worn my mask as frequently in spaces like grocery stores and things like that. However, at the same time, I'm very careful still to keep my distance from others and continue to, limit my interaction, with other folks. And so sometimes I will, particularly if it's a crowded space where I know, with capacity limits relaxed, I'll throw it on just, because I'm routinized in that. And given, so many people, with the different variants going on, and you're right, there's still folks who aren't able to get the vaccine due to different, whether they're immunocompromised or due to their age. But I am trying to, instill some confidence potentially in folks to feel more comfortable if they've been fully vaccinated, being able to be in open spaces without it. Now, that said, when I do go work out, particularly if I'm going to be in a smaller confined room, the spin studio, or in a smaller studio working out with a lot of people, I will sometimes continue to wear my face covering in those spaces just due to, ventilation and those kinds of things. And that I will say that's not always, if I'm lifting weights, and again, it's a light capacity, I'm more inclined to not wear it just, due to limited exposure to other folks. And so I use that as an example to say that as people move through and move forward, even being fully vaccinated, we recognize that there's different levels of confidence, if you will, in terms of being able to, not necessarily confidence, but comfort I would say it's probably more comfort than confidence in terms of being in spaces with others. And that's why we continue to support folks. If you say, hey, I know I'm fully vaccinated, but I'm still going to wear my face cover because it gives me a greater sense of self-comfort. And that's totally fine. And that's uplifted. But we do want to make sure that folks understand, again, to go back to a point that was mentioned by Dr. Bridges and Dr. Stoddard, is the vaccines are efficacious. They do provide protection. And they are an important step if you've been fully vaccinated and achieved that status. Now, one thing I will mention, though, that is important to note, that wearing face coverings also has other benefits and outside of the COVID space. And this is a conversation we'll probably and likely engage in the fall when it comes to flu prevention and allergy season. As a person who has seasonal allergies pretty bad at the change of seasons, the face coverings helped me tremendously when the seasons changed this year from an allergy perspective being outdoors. And when we talk about flu season coming up this year, obviously we want as many people to get vaccinated as possible with the flu shot. But we saw last year when people were wearing face coverings, we saw a drastic decrease in terms of the number of flu cases. So I want to prime people for that conversation as we move forward in the fall, because and in fact, here's my face covering here because I'm in a healthcare setting. I'm in our office where we still require it. I don't want people to automatically associate the face covering only with COVID, and understand that it also can have other benefits other parts of the year in terms of minimizing disease transmission for other things. So I hope that answers your question.
It does. And
not 100% slam dunk, but just being real in terms of how I think through things.
Well, it does. And I also appreciate the fact that people are much more aware that they should wash their hands, that they should do the things that they should have been doing all along, candidly. But now we're all aware to do that as well. So again, thank you all for everything that you do. I'm going to turn it back over to Council President. Thank you.
Thank you so much. Councilmember Rice.
Well, thank you very much. And Dr. Gales, I have to share with you, I was at a conference, the first conference that the Gaylord National has had in some time. Thousands of people there, some donning masks, some not. Requirements for vaccination. In fact, prior to us being able to do some of the interactions with the vice president who was there, we all had to have COVID testing on site, in addition to proof of vaccination. So folks are really encouraging the best practices, I think, to ensure and keep everyone safe. Daily checks every morning in terms of symptoms. You had to answer a questionnaire similar to what our schools are doing. So we see that in a lot of areas, folks are doing the right thing, and that's encouraging. I will say that while Dr. Kroll, who attended the meeting, he was a panelist at one of the events at the National Association of Counties, and I were talking, a young man came up to us and said he was from Montgomery County and was very proud of what he had heard from Dr. Kroll and the work that he had been doing around health. And Dr. Kroll asked him, he was donning a mask. He said, had he been vaccinated? And he said no. And proceeded to have a conversation with this young man about why it was important and why he needed to do this. This was a young Black man, right in the place where we know we're seeing the most risk and the most adverse effects. And I think through that conversation that lasted probably realistically about 5 minutes, which is a long time, both Dr. Kroll, myself, weighed in on the importance of him to get vaccinated, both he and his fiance. They have children. And so it really was something where we continue to impart the need to do this. I think at this point, we are beyond public policy. We are at the point where it's going to be those individual conversations with people who have already been vaccinated, who need to start reaching out, not only just to their family members and friends, but to simple strangers, and talk to them about what it is that we know is going to help save this community and allow us to really get back to where we were before the pandemic. And especially with the variants that are out there, we need to continue to remind people about the importance of why you need to do this so that these other strains can't take hold and become another pandemic. We don't want that. And so I wanted to ask you, because we had a conversation about this afterwards, Dr. Kroll and I, just about the need for us to continue to push. Are there other best practices that you can give, like Councilmember Duando says, to the millions that are watching at home, but to all of us in all seriousness, about what it is that we can do outside of public policy to make sure that we continue to impart on people the importance of getting vaccinated and why we need to do this now.
Thank you, Councilmember Rice, for your question, and also thank you for the conversation that you and Dr. Crowell had with that individual, and hopefully change their mind to get them vaccinated and covered. I think the most important thing is that it's the type of conversations that you mentioned right now. You know, if you need a vaccine, now this is different from how it was before. If you need a vaccine, you can get a vaccine. They're much more easily available to the broader public. And even within that, I think we have to continue to be mindful if there are any types of obstacles or hindrances for any individuals to get vaccines. We'll continue to monitor that from a policy perspective and logistics perspective. But realistically, they're broadly available. And, there's lots of policies, there's incentives, there's all these things that have been put into place, but you're right, it's the individual conversations and engagement. And there have been a number of strategies thrown out. I know at the federal level, there was conversations talking about utilizing barbershops and hair salons to be able to have those levels of conversations. I think so that's an example, I think, of creating spaces and tapping into venues that people readily use, that are trusted sites where they feel comfortable having conversations to express their reticence. And I think one of the things, in thinking about how you described the interaction with all of you all at the conference, was I would imagine that young person felt comfortable being able to say, yeah, I'm not vaccinated, here's why. And I think the most important thing is being able to create spaces where folks can have those candid conversations and say, well, it's either my ideology or I, had a bad experience, whatever the reason is, to be able to have a dialogue and discourse around that, to talk through those particular things. It's harder to do that in larger venues and groups. It's easier to do that when you're having one-on-one conversations. And, let me be clear, my attempt in the beginning was not to shame folks who are not vaccinated, but to clearly lay out that when we're seeing new cases, it's in certain groups, and that group happens to be those who aren't vaccinated. So I think having, creating spaces and venues to be able to have that level of conversation and discourse is meaningful, in addition to the continued larger efforts in terms of outreach, that all of our community partners continue to engage in, continuing, and then for a small subset of folks, there do continue to be logistical issues in terms of getting them connected to the physical vaccine space, and we'll continue to work through that to make sure that they are proximate to the communities that need them the most, where uptake is lowest, to ensure that those types of barriers aren't a reason why someone isn't able to get the vaccine.
Thank you very much. Thank you, Mr. President.
Thank you, Councilmember Rice. Thank you all for your great answers. Any other requests to speak? If not, as Councilmember Katz said, thank you all for your life-saving work. We just continue to get great news from you, and we really appreciate it, because we know it doesn't happen by itself. It happens due to all your dedication and hard work. So thank you so much, and we'll see you again in a couple weeks.